Hello, everyone, and welcome to the third day of Lymphoma Canada's National Patient Conference. Our first session of today is a panel discussion entitled How Cancer Takes a Toll on You. And we have a lovely facilitator today, Sabina, who will be prompting questions to our panelists and leading today's conversation in the different ways lymphoma can impact your life. Sabina is a longtime supporter of Lymphoma Canada and the vice chair of Lymphoma Canada's board. So I'll pass the presentation over to her so she can introduce today's panelists.
Thanks so much, Sarah, and thank you everyone for joining this session today. Receiving a lymphoma diagnosis can change one's life in many ways. While lymphoma impacts everyone differently, there are a few common challenges which people have to navigate. This includes, but is not limited to, physical impacts such as side effects of treatment, emotional impacts, shock, the disbelief, the fear, the anger, anxiety, often grief. The social impacts, such as changes in relationships with family, friends, colleagues, establishing support systems, financial impacts, such as taking time off work to get treatment or traveling out of province to receive treatment. And then to add to this, the pandemic's impacts, so wait times to see physicians, the isolation, potentially delayed treatments, and much, much more. Whether you're newly diagnosed, undergoing treatment, or a cancer survivor, there will be a topic in the session that you will be able to relate to. In this session, we will have an in-depth and honest discussion on the ways lymphoma can impact one's life with our incredible panel, who I have the utmost honor of introducing today. First, we have Blair. Blair Connolly lives in St. John's, Newfoundland, with his wife and 2 children. He lives a very active and business-oriented lifestyle and was diagnosed with Hodgkin's lymphoma in May of 2021. After 6 months of intensive chemotherapy, he received a positive result from his doctor and has been in remission since February. He is currently working on revamping his career to focus on new, innovative, and socially responsible ways to blend his healthcare and gaming experiences. Welcome, Blair. Next, we have Sarah. Sarah Norton is a registered nurse at the Stronach Regional Cancer Centre in Newmarket, Ontario. Sarah graduated in 2016 from Trent University and completed her Canadian Oncology Nurse designation. Previously, she worked at the Ottawa Hospital on the acute leukemia and stem cell transplant inpatient team. In her current role, she works as a primary nurse for malignant hematology and oncology patients. Sarah is passionate about providing patient-centered care that addresses all the needs that come with the cancer diagnosis. Welcome, Sarah. Next, we have Ian. Ian Scott is the Adolescent and Young Adult Psychosocial Clinician at Cancer Care in Manitoba. He obtained his BSW from Lakehead University and his MSW from the University of Victoria. Ian provides counseling to teens and young adults with cancer and their family members. He also facilitates the Young Adult Cancer Support Group in Manitoba and is involved in different clinical and research initiatives to improve care for young adults. Welcome, Ian. Next, we have Dr. Skrbeck. Unfortunately, Dr. Skrbeck's video is not working today, but she's very much here with us. Dr. Skrbeck is a hematologist with Cancer Care Manitoba and an assistant professor of internal medicine at the Max Rady College of Medicine. Dr. Skrbeck's research contribution focus on non-Hodgkin lymphomas. As head of the lymphoproliferative disease site group, part of her role is to oversee clinical research activities and collaborate in clinical trials provincially as well as nationally. Welcome, Dr. Skrbeck.
Hello.
And last but not least, we have Dr. Shruti Kodad. Dr. Shruti Kodad completed her internal medicine residency and fellowship in hematology at Narayana Health, Bangalore, India, before joining the Leukemia BMT program of British Columbia as a clinical fellow in 2016. She currently works as a staff hematologist at the Saskatoon Cancer Centre. Her clinical and research interests are in lymphoma, CLL, and stem cell transplants. Welcome, Dr. Kodad. Thank you all for joining us today in this session. To our panelists, as well as our audience members, there are 5 major themes of today's discussion. We'll be focusing on physical, emotional, social, financial, and pandemic-related impacts on lymphoma cancer care. Please feel free to use the question and answer box located at the bottom of your screen and send in any questions you may want to ask our panelists. We will take these at the end if we have any remaining time. Without further delay, let's dive into our first question, which I'm going to be posing to Blair. Blair, could you start us off with telling us and sharing with us what physical changes did you notice during and after your cancer treatment?
Sure, and thanks Sabine, and welcome everybody. For me, the most significant physical changes for me was the massive weight loss that I encountered for, I guess, pre-diagnosis. I had gone from about 225 pounds down to 170 pounds in about a month or 5 weeks, which was extreme and very quick and very rapid. So that was an incredible change for me. So physically, that was like I went from a normal person to a shadow of a person in less than 2 months. So the weight loss for me was the single biggest change, and probably the one that I had the biggest challenge with. And it kind of felt like there was a new person in my body. It was not the body that I've become accustomed to for 40 plus years. And it was really terrifying. Luckily, as the treatment started, I started to put weight back on, and that was a huge relief for me. And some other things were hair loss, which was expected, but I had cut it short in anticipation, so that kind of alleviated some of the stress. But mainly physically, the biggest physical challenge for me was the enormous weight loss and how quick it happened. But luckily for me, I guess I was fortunate that over time and not too long, the weight started to come back on and the muscle tone started to come back. So that was probably the biggest challenge for me.
Thank you for sharing that. I really appreciate hearing your perspective and what were some of the challenges that you noticed when you were originally diagnosed with your cancer. From a physician's perspective, Dr. Kodad, I'm going to pose this question to you. What are the immediate impacts of a cancer diagnosis? And do you see any differences when someone is diagnosed with a cancer for the first time versus those when it's a relapse?
So whenever we discuss or first meet a patient in the clinic, and most of them do know about the diagnosis before they come to us because they would have already undergone the scans required for it or the biopsy required for it. But still, the adjustment to the fact that they do have this cancer diagnosis, they go through a wide range of emotions. So that's the first reaction whenever I meet them. Just the sense of why me or what did I do wrong? I think that impacts them more than a physical impact as such. It's also an emotional problem, which happens at the first meeting. And it's also a lot to process. We give them a lot of information about what is your cancer, what we're going to do, and we talk about the plan. And this is at a stage where they're still like processing all this information. So it's a lot to take in. So the amount of information which gets absorbed is very, limited at that point. So we do think that the information needs to be repeated at a later point when kind of the feeling has sunk in. Coming to the physical impacts of this new diagnosis, when they start chemotherapy, obviously just chemotherapy, that very term instills fear in some people. They always anticipate being sick or like nauseous or vomiting. And I think that affects them quite a bit. The weight loss part, as Blair rightly pointed out, I have seen that affecting them, my patients especially, a lot, not just from a strength point of view or a muscle strength point of view, even as an appearance or from a social perspective, it does affect a lot of people. Just the body image issues because of the hair loss, because of just their appearance, it affects them significantly and sometimes can lead to social withdrawal. The chemotherapy does come with other side effects like neuropathy. Some people have more neuropathy than other people. So these are some of the challenges which they really, really go through. And they are not easy, and we do acknowledge that.
Thank you for
And,
taking us through that.
Yeah, and coming to your second part of the question,
Mhm.
like, are there like any similarities or differences to those that experience a relapse? To be very honest, even though they have undergone the exact same situation before, it's not any easier. Just taking that news that the cancer has come back definitely is more difficult than it was the first time. So it is definitely a more devastating news. And then because they've already gone through this path before, they have seen what the chemotherapy can do, what kind of side effects they may or may not have experienced last time. It does instill a lot. It can be frightening, especially if the first time was hard for them. It definitely can be more frightening. So yeah, the second relapse, the second time around when they receive this news, there's a lot of similarities and probably more anxiety. Differences wise, I do think the supportive medications, having how they learn to manage their side effects, that is a little bit better around the second time. So in a way, that's the only relief, and they know what supports are available to them. They're more well learned by that time.
Mm-hmm. Thank you for taking us through that. And so a diagnosis, whether it's the first time or if it's a relapse, can be overwhelming. It can cause a lot of anxiety as well. And so, Ian, I want to ask you, from your line of work, I know you work very often with younger patients. Do you find there any differences in the way patients cope with a new diagnosis? And does that differ based on, say, how old they are?
Yeah, thanks, Sabina. To answer this question, I'm going to have to speak in general terms, but I do have experience working with people across the lifespan with different ages too. And I think how someone's going to cope with their diagnosis will often depend on the events leading up to the diagnosis. And we know that delayed diagnosis happens with more frequency for young adults. So if someone's been going to their family practitioner or walk-in clinics or the ER, and they've been told 3 or 4 times that, oh, the itch you have is probably because you're using the wrong soap, or you're having sweats at night because you're anxious. And then they find out quite a bit later that, in fact, no, it's been lymphoma all along. That can be quite a shock. And of course, people of any age can experience shock and disappointment and even emotional devastation sometimes because of a diagnosis. But the other point I would make about when you're diagnosed when you're younger, or a couple of different points, is sometimes you're the first person in your peer group or your friend group who's experienced a serious life-threatening diagnosis. So sometimes the people around you don't really know how to react and how to support you. And also you are often in a different stage of your life, right? So if you're just like, I just want to get through this university term so I can write my exams, and at least those will be in the books, and before I start chemotherapy, it's like such a interruption to that important life stage. So those are some of the differences that I would see in young adults when they're diagnosed with lymphoma.
Thank you, Ian. Sarah, from your perspective as a nurse, what are some of the ways you support a lymphoma patient that is experiencing physical discomfort while undergoing cancer treatment?
Yeah, thanks, Sabina. When I think about that question, 3 main points come to mind for me. The first one is that I think it's so important that the lines of communication are very open with my patients, that they know who to contact and when to contact. The center, the after hours program that we have, so that patients aren't sitting at home suffering with side effects. The second point being education, which I make my main priority with my patients is, making sure that they understand. And this is repeated because, much like Dr. Kodad said, absorbing all this information at the first visit is next to impossible. So just going through that education time and time again, what to expect, what could happen, what might happen, and that, the messaging is that just because you're on chemo doesn't mean we want you to be at home feeling nauseous or feeling sick, because I think mainstream media kind of shows that that's what's going to happen to you when you're on chemotherapy, and sometimes patients just think that that's the way it's going to be, and then they don't let us know. The third main thing that I like to acknowledge too is asking very specific questions when I see my patients. So as a primary nurse, the patients will come to clinic before they go to their next chemo cycle. And when I see them, I don't just ask, hey, how have you been since the last time I saw you? I ask really specific questions. Did you have nausea? Did you have diarrhea? Do you have tingling or numbness in your hands or your feet, to make sure these side effects are mitigated early, encouraging patients to give us a call to make sure that these symptoms don't get worse as while they're waiting at home to see us at their next visit.
Thank you, Sarah. One of the side effects that we haven't really touched upon very much so far is really to do with sexual and reproductive health. So Dr. Skrbek, maybe if I could pose this question to you, how can lymphoma impact an individual's sexual and reproductive health, particularly for females, and what options are available to preserve fertility?
Thank you for that question. So this is something that is a common concern of patients, and fertility concerns maybe more so the younger patients, but it's important that we don't, assume anything when we're assessing people. So first off, in terms of fertility, most chemotherapies, particularly sort of the traditional chemotherapies that we use, like cyclophosphamide in CHOP, or the chemotherapies that we commonly use in Hodgkin's, can have an influence on fertility. Generally speaking, the degree of long-term influence is fairly low in patients who only require one line of therapy, meaning like they only need treatment once. But that can change as if people relapse or require further treatments, which is hard to predict at the onset of management. So I think that it's important, if people have concerns about fertility, hopefully their physicians are bringing it up early. I like to refer people to fertility specialists, because I am not a fertility specialist, to discuss some of the options that they have. For males, we can do sperm banking or semen cryopreservation pre-treatment. And for females, it is a bit trickier because it's more expensive and it's more cycle dependent to preserve oocytes or eggs. And so honestly, most patients do not opt to do that after they speak to the fertility specialists. I think both due to, their need to start treatment, as well as the cost to the patient. And so hopefully that answers the fertility side of things. Also important post-treatment in people who are thinking about starting a family, to ask questions to the physician about timing and in terms of safety, as well as getting assessed if there was an impact on their fertility. I do find sometimes people assume that they're not fertile, and so you should not use chemotherapy in the past as a form of birth control, because that's often ineffective. In terms of sexual concerns, that's even more broad, not just limited to adolescents and young adults. And I think that if you look at studies, it's a common concern and very commonly impacted for patients with lymphoma. Something that honestly, I don't think that physicians do a very good job of talking to patients about. But it's something that I hope that if there is a concern, that it can be brought forward to myself or someone else on the care team.
Thank you so much, Dr. Skrbek. Dr. Kodat, I'm going to come back to you. In the conversations we've had so far, we've talked about how it's multifaceted and there's many layers to it as well. So is there a potential to actually have multidisciplinary teams that can be put together into a patient's care team to help them cope with the lymphoma diagnosis, help them navigate some of the difficulties related to this journey?
Definitely, yes, because lymphoma is literally a life-changing diagnosis, or any cancer for that matter is a life-changing diagnosis. It definitely needs many teams to manage or help the patients to go through this journey of their lymphoma or any other cancers. So I would say, like, I do think like most or all of the major cancer centers definitely have all these resources to help these patients. So the first layer, I would always say that the first layer is kind of dependent upon the nursing, the physician, and the pharmacy team. So they are taking care of the chemotherapy part and trying to manage the side effects as much as they can, especially with the help of the drugs, and trying to assess them, identifying infections and complications early. I think that's kind of the first layer. The second and the most important layer, according to me, is the team consisting of occupational therapy, physiotherapy, social work, and dietitians, because we do have to make sure that once these patients receive chemotherapy, or either as an inpatient or outpatient, depending on the regimen they're getting, when they go home, they're able to lead an independent life. They're, fit and safe at home. They are able to function at least near to baseline as they were before. So this is where our occupational therapy and physiotherapy, teams help us quite a bit. With social work support, we have a lot of emotional support counseling services available to them. We do recognize that there is a huge financial impact whenever somebody is like taking time away from work and then, trying to get this cancer under control and trying to beat that. So they do need some guidance about what's the best option available to them, what resources are available, like especially financially, to kind of make through this journey of theirs. Dietitians definitely play an important role, especially during chemotherapy, and patients are not feeling like eating, and they really do not know what is the best they should eat, they shouldn't eat. There's obviously like a lot of questions about that, and there is this anxiety about losing more weight, or what they should do to maintain their weight and maintain their health in a general way. So I think these two layers definitely help quite a bit. And out in the community, home care helps us, and that's another a pillar of support for our patients to access. Especially in some cases, we do need home care assessments because they may not be fit enough immediately as soon as they're discharged, so they need like an extra layer of care there. And apart from the healthcare team, we are very lucky to have some support groups available for these patients. For example, just healing by relaxation, something, a concept which is out of just the talks about chemotherapy or drugs or side effects. It's practicing mindfulness, the groups which focus on just body image. I think that's also an important layer. So I think these as a whole, all these teams kind of form a very good support system to help patients through this cancer journey.
Yeah, the holistic team effort is going to be very critical for patients. So thank you for taking us through all of those layers. We've spoken a lot about some of the physical impacts of diagnosis and treatment, and I want to switch gears a little and talk a little more about the emotional aspects. And I know many of you have touched upon this, and I really just want to dig deeper into it. So Blair, I'm going to come back to you again, and from your perspective, was there anything, or was there any person or anyone who brought you comfort during your diagnosis and treatment that you can share with us?
A great question. Well, for me, I think the single biggest thing for me was my little guy. So he was 9, and he was playing hockey, he was playing baseball, he's playing soccer. He's a big sports guy, and he's kind of coming into his own as a little athlete, and it meant everything to me to try to get to his sporting events. So as much as I could, I'd get there physically. If I couldn't, my wife would try to, FaceTime me so that I could see it. So for me, from an emotional standpoint, that was huge for me just to be able to see it and participate. And where I looked different to him, I wanted him to see that I was present for him. So, just to make sure that he was comfortable, and that for me, just to watch him play sports and not be too affected by the situation meant the world to me. My wife, my friends in general, text messages, pictures, little notes, people going above and beyond the call of duty to do a little bit more, for your family, to bring you some food. These little things all meant the world to me as you're trying to wrestle with what this is all about, because a month prior you're healthy, and then all of a sudden you have this journey in front of you. So just kind of a million little things, and I don't think, or I believe the littlest thing from a friend or a colleague or family member may not seem like a big deal to them, but to the patient it means the world. So I cherished every note I got, every picture I received, and you really do know, you kind of separate your true friends, from those who maybe aren't in that category. So I thought, to me, that was the single biggest thing. I did also, there was one, you said, is it a person or is it a thing? I received a gift, it was a quilt from a company in Victoria, BC. They're called Victoria's Quilts, and they're put together by cancer patients for cancer patients. So when I would go to my chemo treatments, I would always bring that quilt, and it was warm and it was comfortable, but it just meant it meant a lot to me, and the person that gave it to me, and it was just it was quite, for me, it was emotionally supportive, I guess. So a shout out to Victoria's Quilts, if I could throw that out there. And I also practiced some journaling during the 6-month window, kind of on again, off again, and when I was stressed. And it is very stressful to just sit down and have some quiet time and collect your thoughts and write them. It was very comforting to then look back, maybe a week later, month later. I've actually gone back in a remission state and read some of the things that I wrote, and it's been very interesting, the frame of mind you're in at that point in time. So those are some of the things for me as a patient that were very comforting to me, and I think maybe the culmination of many things helped me get through it and get to a positive, successful outcome.
Yeah, the power of community is really something. And speaking just to some of the tips you've shared, especially with respect to journaling, I think that's such a great point. And I'm going to pose the next question to Ian and build up on this. It's common for patients to experience anxiety while waiting for their results, whether it's from a scan to confirm diagnosis, or it's while you're monitoring response to treatment. What do you suggest patients do to help process these feelings? And are there any resources or tips or tricks that you can also suggest? You're muted. Ian.
Unmuted now. Okay, absolutely, Sabina, and thank you, Blair, for teeing me up so nicely here with your story, and thank you for being here to tell your personal stories too. That's very, very helpful, and I think the panel very much benefits from your presence. So, in addition to journaling, there are other things that people can do, and yes, to answer your question directly, Sabina, anxiety related to all of those factors, all those stages through a cancer diagnosis and the entire trajectory. It's very, very common. Even a term, scanxiety, has been coined related to the anxiety related to scans and getting scan results, right? So the first thing I would say is that, and sometimes we get lost on this point, is that it is reasonable to feel a good deal of anxiety when you are told you have cancer or you're waiting for a scan result. It's not like some sort of problematic thing inside you. It's a very human reaction to this kind of life-threatening diagnosis, right? And the news that's like, oh, what is that going to mean, and the implications for my life. So I think just like normalizing that a little bit, that anxiety is expected to a degree. Like you don't want it to be so overwhelming that it's affecting your coping or your ability to get through the day. That's when you can start to reach out to the things that work for you. And for Blair, it was journaling, it was spending time with his son, watching him play sports, it's finding an object that gives you comfort. There's other options too, to the degree that you can do some light exercise, depending on your physical capacity at the time. That's super helpful for anxiety. Some people really get into meditation as well too, and they find that brings them quite a bit of peace and centering themselves. And seeking out counseling and other people to talk to about how you're coping is very, very helpful as well. So all of those things can help. And another like very simple cognitive strategy that to throw in there that some people find helpful is just remember, as anxious as you may be feeling and as worried as you may be about what your doctor is going to say when they are interpreting your results for you, the amount you worry leading up to that conversation doesn't actually change what the image looks like on the scan itself, right? So that's easier said than done, but just reminding yourself that you're not controlling the outcome of the scan based on how you're feeling about the scan. So that's just a useful reminder for yourself if it helps.
Definitely very helpful tips and tricks. Thank you so much, Ian. And I'm going to pose a similar question to you, Sarah. From your perspective, can you share with us different ways lymphoma patients have navigated with the ups and downs of the disease?
Yeah, I think, every patient is different. I've had I've seen lots of patients, different ages, different diagnosis. One thing that I think is a common collective thing that people use is social media. I mean, especially given the pandemic and a lot of our support groups were not available, the ones that would really bring patients together to have a shared experience. I think people have turned to social media, meeting people from all over who have shared similar experiences, but also offering a chance to have those discussions with other patients that actually help you to advocate for your own care. So that's also, I think, a benefit to that. I've had a lot of my patients actually join our patient advocacy committee too within our cancer center to help make the experience better for someone else, which I find, very inspiring, because I can't imagine, going through this journey, going through all of these hardship, and then turning around and saying, you know what, I'm going to make it better for someone else. I think it's super inspiring. And I've had lots of patients do that, whether it be within the cancer center or in the community in general. Patients never cease to amaze me in what they manage and what they deal with their families and their friends and navigating all of that. I could talk forever, but yeah, those are a few things that I've noticed.
I love the aspect of the inspiring others as well. In fact, I think our last year's panel was on patient advocacy for the exact same reason, and you see that a lot within the community. And again, I come back to the community's power. That idea that community can actually join together and make some of these really impactful differences. And speaking about that, Dr. Skrivec, from your perspective as a physician, have you seen positive ways in which families, friends, community have supported their loved one during their cancer journey? Could you share some of that with us?
Sure. Well, I think that you see, different things all the time, but common things are simply being there for the person, for their appointments, whether they be, the in-person appointments or, sometimes virtual now. Having that second set of ears is really helpful. And that's one thing that I think was a big negative, unfortunately, of the pandemic, when we were restricting having that additional support person to come to appointments. So, people don't always know the right thing to say or the right thing to ask, but just having someone there with them, I think, can be of great help. Family often is proactive in terms of, keeping track of questions that their loved one wanted to ask, because sometimes, you get overwhelmed at an appointment and the patient themselves kind of forgets. So that kind of prompting helps. And I mean, there's many other unique ways that people have supported their families, to kind of making little, milestone type celebrations, which is something that people love to look forward to. And so I think, though, it doesn't have to be anything big, just the simple things can make a really big difference.
I completely agree. I think that, the little things sometimes, as Blair also mentioned, that sometimes it's that little contact that means so much as well. And so moving on, I think we're going to switch gears. We've talked about the physical, we've talked about the emotional. One of the things that, we don't often talk about is the financial impact with the cancer diagnosis, which can be, fairly challenging for a lot of patients as well. So let's spend some time talking about some of the workplace navigations and financial navigations that cancer diagnosis can sometimes also entail. And so perhaps I'll start with you, Dr. Kodad. Could you perhaps speak to some of the physical effects of lymphoma and how that can impact a person's ability to work?
Yes. So mostly it's one thing about planning your life around the chemotherapy treatments. And most of the times they do have to restrict going to work, or because they're immunocompromised, they are just unable, they don't have the strength to carry on the work at the same capacity as before. And most often than not, we do advise patients that, okay, you may have to take time off from work. So that itself, causes a huge financial setback. Most of the time they are able to, the work is able to accommodate, and we definitely provide with all the documentation support which is needed so that they can go through their cancer treatments without having to worry about the work aspect. The second problem is, even if somebody really wants to push through and then continue working, the chemotherapy related side effects do prevent that. Like, they seem like they will be able to do it, but then as they continue to do it, they realize that how fatigued they are unable to focus. Sometimes the chemo brain itself, affects quite a bit in their day-to-day activities, just not just the work, but even the day-to-day activities. So I do think that these are some of the aspects which I see when the treatment is going on. Having said that, even after the treatment completes, it's not that the fatigue just disappears and all the side effects just go away just like that the very next day. They can linger on for a few months, and sometimes even up to a year for some people. And so just a graded return to work depending upon their capacity, and basically listen to their body is my suggestion to most of my patients. But yeah, just adapting their life post chemotherapy or during chemotherapy is extremely important.
Thank you for that. And I'm going to continue on this line. Ian, for you, in your role as a social worker, can you describe to us how a cancer diagnosis can also impact someone's employment? I know we've heard from Dr. Kodad. I would love for you to expand on that as well.
Yeah, Dr. Kodad hit a couple of the really big ones with brain fog and fatigue, and fear of recurrence is another thing that happens when you're trying to go back to work and you're like, well, can I just wait for another 3 months or another 6 months so I get another scan before I feel comfortable re-entering the workplace? And the other thing that people are navigating is like, who do you tell? How much did word spread while you were gone? If you were off work, what's your, do you talk to your manager first, your insurance company first? What are you going to say to people that you're really not close to, who are just kind of being nosy? And then those who you do want to share a little bit more with, how are you going to navigate the work environment is another very common experience that people are having to deal with. And then there's also a group of people, not everybody goes through this, but cancer diagnosis can allow them to reflect on where they are in life, and they're starting to think about a career change or going back to school, and all those things and all those costs that are involved with that kind of transition as well. And one other really important piece, and I have to give credit to Lydia Beck, who's an occupational therapist at Princess Margaret in Toronto for this observation, is that it really helps for patients to think about their return to work as part of their recovery. You aren't supposed to be 100% recovered when you go back gradually. You should be a decent way along that path so that it's not totally overwhelming. But if you're waiting to be 100% recovered to go back to work, then you might never feel that that's a surmountable challenge. But the reason why you go back gradually is because it is part of your recovery. So I wanted to just allow that, because that sort of mind shift can really help people on their return.
Absolutely. Yeah. Thank you so much for sharing that. And speaking, Blair, for you, speaking specifically on the workplace environment, how did your lymphoma diagnosis and treatment impact your employment and social connections at work, or did it?
Oh, no, it did. So when I was diagnosed, it occurred at a pretty precarious time in my life, because I guess a year or two prior, I had some troubles with the business that I had owned and operated, and it went into receivership. So I didn't have the luxury of kind of full-time employment and insurance to lean on. So I really had to work through. Now, my employer was amazing at the time. So my new employer, and they were very understanding, and they said, do what you can when you can. And I found that was very helpful and supportive. So I did work through it, not 40-hour work week. That would have been impossible. But I found working when I could, as best I could, fairly therapeutic for me, because it gave me something to focus on and dedicate some time to. But I know it's been mentioned a couple times, the chemo brain concept and the fogginess and the inability to focus, and that is real. Like that is frustrating, because it's something that I never had before, and all of a sudden it's very real. So that's a struggle. Work for me was a fairly therapeutic, in that I was able to work through it, not full time, but I think if I had to cut it off entirely, it would have stressed me out, and financially I couldn't afford to do it. So I just kind of plowed through it. I was very fortunate as well to have supportive coworkers, bosses, colleagues, etc. And I didn't make it known to many people, but it's a small town, it's a small community, and it doesn't take long. But they were very supportive. They were conscious and conscientious of my privacy, but they would reach out, and I felt very appropriately, and I thought that was quite supportive. And the social media piece. So even during a pandemic time, if I couldn't go to work, we could do video calls, and I could participate in social events via social media, via video calls like we're doing today. So for the most part, the work piece was helpful for me. But the financial impact, the potential financial impact for me was very stressful. But I was able to get through it with the support of great colleagues and coworkers. So that's hopefully that answers your question, Sabina.
Absolutely does. The supportive workplace really is critical in that recovery phase as well, right? That's great. Thank you for sharing that with us. And on a more broader social side, Sarah, I'm going to pass this question on to you. Do you have any recommendations on how people should talk to their loved ones about their cancer?
Yeah, this is like I think this is one of the most challenging things for patients. And for me, it is a difficult thing to give recommendations on, never experiencing it. But the best advice I can give is that to do what you're comfortable with. I think to be very kind to yourself, and not to put too much pressure on yourself with having to tell your whole family, having to tell your workplace. I think just taking it one step at a time. If you need to just be in this with your partner to start out, that's okay. I think there's a lot of pressure, and I think patients also take on the burden sometimes of other people's feelings. And of course, that's your loved ones, and you don't want to see them get stressed and upset and emotional. So I think just taking it day by day and really setting boundaries as to what you want to share, who you want to share it with, and not trying your best not to feel, guilty about that. I think that's one of the bigger things. And of course, I also engage our social work team. They're amazing. They have a lot of experience. So if a patient's having a particularly hard time, I'll definitely encourage them to speak with our social work team. They're also excellent at helping navigate those conversations with children, which I know challenges a lot of my patients.
Thank you, Sarah. And I'm going to actually, Blair, come back to you. And I have a couple of questions for you. So my question for you was, did your diagnosis of Hodgkin's lymphoma change any of your relationships in your life? And if so, how? But I want to tack on to this a question that we actually received from our audience. It was specific for you that sort of is in the same vein, but one of our audience members wants to know, how did your friends feel when you told them about your diagnosis? And what was your experience like with your friends and their support during treatment? I know you've mentioned your friends' support quite a bit,
Right.
as well. And so I want to tack on both of these questions and I'll pass them on to you.
So I guess firstly, I think it's a two-part question. So the first part, I think the relationship with myself, first and foremost, changed. I think it struck me midlife and very unexpected. And for me, what I took from it was, this is potentially really horrible, or it's a gift. And if you have two choices, I'd take the latter. So I tried to take it as a gift, which is a struggle. I really struggled with it early, but I just felt that this was happening. It's terrible. I don't know why it's happening, but it is happening, and I cannot control that it happened. What I can control is how I perceive it, how I tackle it, how I view it. So I really, really tried to be in the moment, and realize that perhaps this is a gift for me, and that I can get through it, be stronger on the other side, help people who, have have lymphoma or have some other cancer, and on the other side of this thing, change the direction of my life. And I really felt that I had rushed through my life. I don't think I was present all the time. And when all of a sudden you have a life expectancy, or you have an expiration date that's put in front of you that's potentially very real, you second guess things that may not be that important. So for me, it was a bit of a wake-up call. And I personally, I think I'm very fortunate to have had this occur to me in the way that I've tried to get through it. So if that answers your question, I think it changed my perspective on life. I tried to look at it as a potential gift that I could get through and help other people. I believe the question from the panel was about friends and how they
whether there were any
me.
other friends relationships, if that changed, if you had to move through any of those changes in relationships with them.
Yeah, well, great question. And I could not say enough about how my friends stepped up and reached out in their own way. There was people who wrote incredible, long letters and or shared memories from the past, and other people would just be very simple, or bringing food, or whatever the case may be. It was, to Sarah's point, they didn't try to be somebody else. They stayed true to themselves, but they expressed love and concern and care. So that, again, that meant the world to me. And you realize your network of friends, how important they are in your world. When trouble hits, that's when your true friends step up. So I can't say enough about them. Forever grateful for that, that group of people. And I believe my relationship with all of them has been strengthened through this tumultuous, kind of troubling, terrifying time. I hope I've address the question?
Absolutely. I think, what you talked about, that chosen family that you've made, right? The impact of
Yeah.
that is just incredible. Thank you for sharing that with us. Really appreciate it.
Oh, thank
And
you.
so, I guess, Ian, I'm going to pose a question to you that might be a little, complicated. What would you suggest to a person that feels isolated because they may not have such a, strong friend and family support system, or a friend and family support system that themselves are having a hard time relating to their cancer experience?
Yeah, that's a good two-parter and a tough one, right? Because even sometimes people who are surrounded by loving friends and family feel really isolated when they get diagnosed with lymphoma, because if people don't really understand how to relate, then it's still isolating, even if you have a lot of people in your life. And sometimes just having one or two really good supports is what you really need. And sometimes it's surprising which of those people step up to the plate and become, your best supports, and other people that you thought would be there for you through thick and thin fall away from your life. And so there's that element going on for people too. I think I'm always amazed, especially since I started working in oncology, like this, even though we talk a lot about cancer in society, there's a very generally like a low cancer IQ of like what it means to have cancer and what people are going through. There's just a couple of common ideas that people expect someone with cancer to be experiencing. And when you don't fit that mold, it's sometimes hard for people to relate to that. So then people who have cancer are put into this role of like feeling like they have to educate other people around them and take care of the emotional needs of the people around them. And that's obviously exhausting. So I think leaning into the supports, and Sarah talked about this earlier, like the groups, and Dr. Kodad did as well, like the support groups and different networks, whether that be ones you find on your own online that you feel are comfortable and well moderated and providing the kind of support that you need, or ones that are from a cancer center or a nonprofit working in this field. Those are really good places to find people who just get it. They might be from a totally different walk of life than you, but they just understand more what you're going through. And I would say for any of supporters or family members on the line is also look into those kind of supports, because a lot of people don't realize there are family supports in a lot of oncology centers and nonprofits for people who are partners or caregivers, or in some respects supporting the person with cancer. And also just try not to overextend yourself, and don't assume what's best for the person with cancer, right? Don't necessarily assume you'd be making decisions differently if it was you who had the cancer diagnosis, because then until you're in those shoes, I don't think you really know what you would be doing, right? So just having that sort of like healthy balance of like giving that autonomy to the person who has the diagnosis.
That's a great point. And I'm going to wrap up this section, on these I guess I'm going to do a follow-up to you, Ian. Sorry about this, but I think you built on this and I want to explore this a little further. And so what would you say, in terms of recommendations for family and friends? How can they support an individual if the individual tells them that they are feeling lonely, or they are feeling depressed, or they're feeling isolated? How can their friends and family support them in that situation?
Okay. So I'm going to ask everyone to just visualize something. Imagine a series of concentric circles working out from the center, right? And in the middle is the person with cancer, okay? And you, if you're a close family member or partner, you are probably on the very next line, or you're right near the center with them because it's affecting you as well. But then as you go out, you might find, acquaintances, and then coworkers, and then people who just kind of know you from around town. And the idea is that it's the direction of where support goes. So you're always supporting inwards, right? So if you're talking to someone who's on an inner circle from where you are on those concentric circles, you should be supporting. If you've got emotional stuff that you want to process and you want to talk through, don't go to the patient with that. Go to an outer circle or somebody else on the same circle as you are, right? So that's one way that people can do that, is like kind of what kind of burden we're putting on patients to provide emotional care and support. And also just doing little things like Blair's already talked about. He talked about notes that meant a lot to him, just like little things like that. They can go a long way, and just be really considerate with the timing and how you talk about those kind of things, because if you can educate yourself on your own time, so don't look to the patient to educate you about these things.
The concentric circle is such a great, really great idea. And I'm going to look into this more as well, because I think it's and I think it can also have utility in a lot of different areas as well. So what a great tip that you shared with us. I'm going to switch gears now and speak more to the effects of the pandemic. And I know a couple of you have sort of brought it up as well. But we've seen, in the last 3 years that the pandemic has had a pretty severe impact on the entire population for a variety of reasons. And one of them really, has to do with the impacts that it's had on cancer patients as well. So Sarah, I'm going to go with you first on this. And in your opinion, what are some of the challenges hospitals have faced during the COVID pandemic that impact the quality of care for lymphoma patients?
Yeah, I think the number one thing is probably that we had to go to a lot of virtual appointments. From a nursing lens, that kind of eliminated that touch point with the nurse. That I think is really important in terms of offering support, making a therapeutic relationship, and knowing who your nurse is. And I know some centers being bigger than others, but ours is growing, but not certainly as big. But my patients will see me in the waiting room, and they'll know who I am. But all of these patients that I met virtually, they didn't know who I was. There wasn't a real connection there. And I think that that's so important. So I think that was one element that really affected the patient, and we did our best. I will say, we tried to do our education over the phone, offer our support over the phone, but it's simply not the same. And I think that it only increased patients' feelings of isolation, not really being able to put a face to the name. The other thing, which was mentioned before, was not being able to have a visitor come in with you to your appointment. And most of the time, if you were coming in for an appointment in person, it was either to get bad news or you weren't feeling well, both times that you really need someone there with you. So that was distressing for us too, as healthcare providers. And it was really difficult. And there were times I sat during the whole appointment with the patient when they received this news, because I was the only one that could be, sitting beside them when they were getting this news. So that definitely is that changes the patient experience completely. Not having that person there with you, not being able to make as much of a therapeutic relationship with your care team. Yeah, I think those would be the top things I've noticed from a nursing perspective, for sure.
Yeah, great points. I'm going to throw the same question over to you, Dr. Kodad, and I'm going to also have Dr. Skrbek, give her perspective after Dr. Kodak on what you've seen with respect to any impacts of COVID-19 on quality of care.
I agree with Sarah. COVID-19 did impact, at the peak of the pandemic, when we were getting newly diagnosed patients, and some of them directly admitted to the ward because of some of the complications. They were very isolated. They were receiving this, devastating news, but they did not have their family members or their loved ones to hold their hands through the meeting. So pretty much it was the physician, the nurse who was involved with the patient's care and the patient. So, and if possible, then the loved ones used to be on the phone or by a cell phone, just virtually, but it was far from ideal. And it not only caused excessive anxiety to the patients, as it also caused the same kind of anxiety to the loved ones. All we kept hearing was when can we come to visit? And as Sarah rightly mentioned, it was the leniency was for people who are really going through a devastating end of life care situation, and only under special circumstances, which was really hard on the patients and their families. Not only that, because it was only the nearest healthcare providers who were there present, it did lead to a lot of staff burnout in the hospital. So that was a very recognizable issue. And in the later stages, I believe, like with the the visitation and the restricting policies, some people who had to receive inpatient chemotherapy, they missed their favorite foods. They couldn't bring their food items inside the hospital, or they couldn't bring their comfort items like a quilt, for example, like that all had to be like wiped down, and it was a whole ordeal. It was very, very hard on the patients. Now, obviously, like we've kind of learned to live with the pandemic, and we know like how to, isolate and be safe still, but allow certain things. The visitation policy is a little bit better. So things have been a little bit better now.
Thank you for sharing that. Dr. Skrback, same question over to you as well.
Yeah, so I would, and this is specifically hospital care or both inpatient, outpatient.
Both
to
inpatient,
clarify.
outpatient.
Both. Okay.
Inpatient, outpatient, yeah, whatever from your
Yeah.
perspective was important. Mhm.
Yeah, so I think that the inpatient side, what was mentioned already by Dr. Kodad, about not having visitors, I think this was absolutely devastating to people. And some patients, honestly, I feel made decisions to not undergo further treatment at time of relapse because of it, because of that not wanting to be in hospital with the restrictions, as well as, a lot of times people really wanted to avoid the ER, partly because they, didn't want to put a burden on the system, but also they were scared of being in the ER. But there's only so much we can kind of do at home. So, I think that was unfortunate. Like, I think some positives though are that we have gotten a lot better at doing video conferencing with people. And it's not ideal, but there's some times where there's a family member who's really involved, who's far away, or there's times where a patient themselves, they have mobility issues, geographically where they live, it's very difficult for them to come in. And so being able to do some things virtually has been an advantage for some patients, with the limitation as well. So it's hard to really list everything that the pandemic has influenced. But and I think that the other point that Sarah made about kind of differences in the team dynamic were things that the patients noted. They just, I had one patient, in fact, say to me that I thought when I got cancer, I was going to have a team, and, I don't have a team because so much of what she was doing was virtual.
Yeah, that's a great point. And you talked about some of the advantage that you had with respect to virtual appointments. And Blair, I know you sort of you talked about social media, and so I was wondering maybe if you could expand on a little about, from your experience, if you saw, any ways that the COVID pandemic has helped lymphoma patients connect across Canada during this time.
Myself or Blair? Sorry.
Oh, it's for Blair.
Oh, sorry.
Oh, so and the question is if through social media it's allowed.
Is it
people
either
to
social
connect?
media, or were there any other ways where the COVID pandemic helped lymphoma patients to connect across Canada? I mean, I can tell you that our panel itself used to be in person, and now we're able to actually have it across Canada because we're able to do it virtually. And I wonder if there was any experiences you can share with respect to perhaps ways that the COVID pandemic has helped people come together.
Well, I guess it's come up, I guess, and I've mentioned it, a few other panelists have mentioned just the social media component, and people in general are more comfortable with this medium, this environment of being having a video call, which 4 years ago, 90% of people would be unheard of. So I think COVID almost mandated that become a new norm, and for me, that allowed me to reconnect with people. No different than if I did not have cancer, but the social media video call new norm helped me tremendously. I think some of the irony of COVID for me was that, for different parts of Canada, it would come in waves when it would be more of a shutdown. And when things were shut down for me, because I also had lupus, so I was immunocompromised, and then cancer on top, being isolated and having to stay home, or all those restrictions, for me, it was almost like I was missing out on less, because everybody was going through the same thing. So in a weird irony for me, COVID almost helped some of the coping. So if that makes any sense,
Absolutely, yeah.
Also I'll share the story with you. So when I had my first my vaccine, which was May, I was relatively healthy, and then I had a cancer diagnosis like a month later. So I really personally, I struggled with the connection between the vaccine and all of a sudden I'm stage 4 cancer. So I know it was probably, illogical, but for me, I was drawing the connection between COVID and all of a sudden a vaccine, and now I have cancer. So I had a lot of questions and concerns about the vaccine. But to your point, it was kind of mixed feelings for me on COVID. The fact that people couldn't come in and be with me when I went in for treatment was a struggle, but yet many more could be with me because of social media. So I tried to look at it as glass is half full. There were challenges, but there were also some benefits. So when in doubt, look at the positives. So it wasn't too bad for me.
In fact, one of the audience members wrote and to share that there were also more online exercise groups and more online support groups that they could join. So like you said, the glass, half full with respect to having some of these additional support systems as well. So that was actually my last question for the panelists. So I'm going to start taking more questions from our audience members as well. One of the questions that came through was, and Sharon, you sort of touched upon advocacy, and so it's kind of building up on that. But regarding full care team, if we aren't getting social or occupational therapy to support, care, what do we do? Can we get the hospital to help with this? And what do patients do in terms of advocating for some of these support systems that may not have initial access to? And so I'll open it up to everyone, but Sharon, if you want to start, you're more than welcome to.
I can go. And so I do agree, it's not easy to come by these support systems. Like if there's a cancer center, then some of these support groups are already in place, and there's usually a wait list. Especially for physiotherapy, sometimes we do rely on the community physiotherapists to help us out. Yes, you could possibly go to your hospital just for referral for these. The only drawback is the wait list is longer in such a setting. But if there's no other option in the community, then I think that's what we'll have to do.
And I apologize, I meant to say Sarah, and I don't know why I said Sharon, but apologies for that, Sarah. I know you had talked about advocacy, and so I kind of wanted to come, back to you with respect to how do patients advocate for themselves and advocate for some of these services that they may not have access to. But Dr. Kodad, that's a great point with respect to hospital wait times, and I know in the question and answer, Dr. Skrbeck also mentioned, so it seems like it's similar across the board in different provinces as well, unfortunately. And Sarah, did you want to share anything to that?
Yeah, I would just kind of echo what Dr. Kodad said too. We use home care a lot, but it is limited. Obviously, everyone's facing shortages right now. So we do have to kind of, triage who we put in and who we put in first. I also just like to find out if people have private insurance through their work that they're still using, because oftentimes we can help them find someone we'd recommend in the community too. Not everybody has insurance, but some people do, and they're not aware of how much benefits they can use. So I do try to have that conversation as well.
Amazing. And I'm going to ask another question here. Dr. Skrbeck, not everyone has access to the Q&A, and I know this is a question that comes up very often. So I'm going to ask you to answer this question live as well. How do we get that chemo brain to go away? And I know, Dr. Skrbeck, you had a great response, and if you could just share that with the audience members as well.
Sure. I mean, I think that this is a great question, and I've often been somewhat dissatisfied when I try to educate myself and read about chemo brain, because there's actually not a lot of research into it. And, we understand that, it's a combination of things why it happens in the first place. So, some people seem to be more susceptible than others, but it seems to be also that all treatments, because of some of their effects on the brain itself, this can be a occurrence. What to do about it is the harder part, and it's really self-care. So it's simple things, like working on sleep. And that itself can be, a big problem for many cancer patients, having disturbed sleep for a variety of reasons. Working on good nutrition, trying to minimize stress, physical exercise is likely beneficial, but also, having mental exercise as well. And so I think that, that's one thing that, during COVID, there are some people that, especially those that are older, that are not as sort of like social media or technology savvy, I think have felt very isolated. And I do wonder if that has contributed to things like cognitive changes from chemotherapy further. Also, if there is, significant anxiety or depression, that needs to be treated as well. So there's no one answer, unfortunately. It's a combination of things, and thankfully it generally does improve with time, but some people find that they struggle for much longer than others.
Thank you for that. And I think I'm going to wrap it up, and I think we have maybe time for one last question. I know there are a couple of folks in the audience who have sort of talked about COVID, and as things have opened up and risk management has been, with masks not being worn and high community cases, there have been quite a few questions about what are patients supposed to do right now. There's an isolation aspect as well. They'll be here and they're not able to go shopping because it ends up being more riskier for them. Does anyone have any suggestions, any recommendations, any advice that they can give?
So I'll try. I think that everyone's perception of how much risk they're willing to tolerate is different, and so people have to, make their own decisions. But I think that as time goes by, it becomes harder for people to continue to isolate, especially when, the community's open and stuff. So no matter what you do, you're, potentially going to be in contact with someone. So what I do tell people to try to reassure them is I feel like we have better tools now than we did earlier in the pandemic. And I recognize that we do see poor antibody response in some of our patients to COVID vaccine. It doesn't, even if there isn't measurable antibodies, that doesn't mean that there isn't some protection from it. thankfully, we also have other tools now like antivirals, so Paxlovid. And I hate to use sort of anecdote, but I'll use one anyway. With our current sort of variant, Omicron, I've had many lymphoma patients with COVID, and some of them we haven't heard about until after the fact, so they haven't gotten Paxlovid. But the ones that we have, if they've gotten Paxlovid, people have done okay. Like, yes, they've been sick, they've had symptoms, but they've generally been at home. And so, I think that I would credit that to the tools that we have now that we did not have before for treatment. So it seems, patients don't like that. It's not proactive, it's not preventative, but it is a really beneficial tool.
It's a great note for us to wrap up this session with. And I really just want to thank all of our panelists today. So much gratitude really to all of you for joining us, having this really honest, really powerful conversation, for sharing your wisdom, your expertise, your experiences, your stories. These have been immensely helpful to our entire lymphoma community. So thank you so much to all of our panelists for joining us today. And I also want to thank all of our audience members for being here for this conversation. So thank you so much, everyone. And I encourage everyone to head to the next session, where actually we will be going deeper into this topic with Dr. Skripek, actually going deeper into some of these conversations. So I encourage everyone to wrap up the session and head to the next session to continue this conversation and dialogue. But again, thank you so much for everyone for joining us here today.
Thank you, Sabina. Thanks, everybody.
Thank
Bye.
you.